All right, well, if you've been to the doctor recently, you may have noticed that paper records have been replaced with a computer monitor. Cheryl Tan is here with more on those changes that are underway relating to your medical file.
Ariane, an electronic revolution is underway in the medical field as hospitals and doctors' offices around the country work to get online with their medical records. It's all part of the Affordable Care Act, and by 2014, those e-records will be mandatory. In Hampton Roads, hospitals and doctors' offices are getting compliant early, meaning there's been a lot of work going on behind the scenes to make sure patients will have what's called one record, one central location where your medical history is stored with easy access for all doctors and nurses who are seeing to your care. Quite a bit going on to get ready for this change. We found that out when we asked one local hospital, what's your problem? At Maryview Medical Center in Portsmouth, the paper trail is disappearing.
Where we used to have records tightly fitting in this file cabinet, it went all the way down to the floor.
The Bon Secours Hospital is undergoing a transformation as employees shift from a paper-based medical record system to one that is all electronic.
Paper will trickle down 3-4 days after discharge, and we've already processed the chart. We have to go back then, find the chart, and put that piece of paper with that patient record at that time. So it was very cumbersome. Now we don't have to run around looking for a patient chart.
Despite all the behind-the-scenes efforts, patients shouldn't notice a difference.
Well, I think it's a lot better for them because of the fact they don't have all them papers to look at every time somebody comes in.
Jerry Eaton started chemo treatments before Maryview switched to e-medical records.
They had a big old file there where they had to write down everything, and it seems a lot better to me.
Eaton, tell us your name.
Jerry Eaton.
For the staff, though, it's a bit of a learning curve.
When a patient come in now, they will sign consent electronically, and they won't see a difference in their care. It's all behind the scenes now. So the nurses will come in the rooms with the computer and enter their documentation at bedside, opposed to going back to the nurse's station and trying to get all of this into the system.
Safety is first, and the computer makes it easier to ensure it.
We get an immediate alert if there are two medications that don't work together. You get an immediate alert about allergies, things along those lines.
It's like a double check system. We check his name and his birthday, or the patient's name and birthday, and then we scan it, and it has to comply to what we're looking at on our screen. So if I scan the wrong scan bar, it would give me an error message. So I've already scanned him for his first pre-med, so I can scan the second pre-med. And all it is finding the scan bar on the medication and scanning it. And that's telling me that his flush is complete from his first pre-med.
Doctors, too, see a benefit. Patient records are available to those who are authorized at the touch of a button.
No one has to interpret your orders. You put them in exactly as you want them, and it goes directly to the pharmacy. If you happen to be at home and get a call in the middle of the night, you can open your computer at home and by a secure connection, look up their labs, their medications, things along those lines, so you can better answer questions when you're off-site.
Bon Secours affiliated physicians are already connected. DePaul Hospital in Norfolk will be switched over to e-records in the next 3 months. And once that happens, something called Care Everywhere will be turned on.
Care Everywhere enables any Epic health system to communicate with the other health system. Everything is available.
That means at some point in the near future, Bon Secours patients in Hampton Roads will be connected electronically, no matter what hospital or doctor's office a patient gets treatment. Centera hospitals are already connected electronically, so their hospitals and doctors' offices can pull up patient records between those buildings. Chesapeake General and CHKD are working on it, and eventually, this is really cool. The goal is to one day have that medical record be accessible to any provider, no matter what hospital or doctor's office you come from. That's years away, but it's one of those things where you wonder, once you have it, how you lived without it before, because right now in some places you can hit a button and there you have a patient's record, whereas before you'd have the files that you have to carry around. So if one doctor had it, then this nurse couldn't, or this pharmacy couldn't have it because it's right here physically.
It's going to make it so much easier. You know, my dad works in hospital administration, and that exact right there is what they're working on, getting all of it from paper to you know, electronic. So it's a long time coming.
I mean, it's a tough process right now. The learning curve is pretty steep, but pretty cool.
All right, thanks, Cheryl.